both before they start their program, maybe even in between if they've got a long practice, and also afterwards to really stretch out those tendons. Again, after this type of vigorous activity, their tendons and their muscles are already real tight because of the growing. And then on top of it all, now they're exercising vigorously. So what's happening is those muscles are contracting, making them even tighter, and that'll cause these type of growth injuries. So that's probably the thing that's most concerning to me about going back to school and exercising and being more active once again, especially in that age group.
Are there specific kinds of stretches that podiatrists recommend for athletes, or is it just a general warm-up will be sufficient?
A general warm-up sometimes will help out, but I mean, even the old Rocky stretch where you're pushing up against the wall and you're keeping your heel planted on the ground and leaning forward, not bouncing the stretch, but holding the stretch to really stretch out that Achilles tendon and really stretch out the plantar fascia, that'll really help out with that heel type of pain that most kids get, which is called Sever's disease. Actually, it's not a disease, it's actually a syndrome, but that's what it's called, Sever's disease of the heel. You can also have the same type of growing problems, tendons that insert into the knee, and that's called Osgood-Schlatter's.
What about when one of the things that the survey that the American Podiatric Medical Association did that was so sort of alarming to me was that it pointed out some nasty byproducts of what can happen if parents do ignore a foot injury, or perhaps let it go for too long, or don't seek out the proper care. Problems that start, like you said, in the womb or at a very young age can develop into serious problems later. Isn't that true?
It is. In certain cases, yes. I mean, the most severe case, going back to that example I was talking about with the heel, where that growth center is under so much stress, I've actually seen fragmentation of that growth center in some kids that was totally preventable, but they're very active into sports and they're really pushed into the sports, and children themselves want to keep on competing where they're actually doing some permanent damages to themselves, such as growth plate disturbances in the bone.
What kind of treatment do you usually recommend to a patient that's got a severe injury like that?
Again, when it's very severe, you want to bring down the acute nature of the pain, and usually simple things, of course, rest, ice, elevation, and maybe if there's a lot of swelling, a little bit of compression or an ACE wrap. But again, it gets more than that after a while. They might need some gait plates or orthotic devices that might help to stabilize it a little bit as the condition becomes more moderate. There are certain types of medications that you can give children that are relatively safe. And again, stretching exercises for when the condition becomes more chronic or when you want to prevent it from coming again.
So getting back to sort of the back-to-school shopping theme for a little bit, because shoe companies of all kinds market products heavily to parents, parents and kids are inundated with brand name cartoon characters, brand name Disney sort of things, and sometimes for the most part these products are fine, but a lot of times they're not. So talk to us a little bit about how parents can kind of resist that and really shop for a shoe that's the best for their child.
Well, speaking as a parent, that's difficult at times, and I'm sure you know that, Chris. You've got children in my age bracket, my kids' age bracket as well. They want what they want, and they want to be in fashion with the rest of the kids. And again, as I said at the beginning of this program, most children that have normal foot anatomy and really don't have many medical problems with it, they'll usually do well with those type of shoes. And they're marketed. I won't mention brand names, but there's athletes that are selling them, and they've got to have this particular shoe. And the problem is a lot of the shoe companies are aware of this. And it's easy to design a shoe that's too flexible, that will break down very, very rapidly, that is going to make the parent have to buy another shoe because it's broken down very quickly. So they're winding up buying shoes 6 to 7 to 8 times a year for their children. When you can go out and you can buy, there are certain brands that actually do have some more stability to the shoe. A shoe that may not feel as comfortable when you first put it on, like you're barefoot, but actually will give you some support and protect the foot during those type of activities.
A lot of people don't realize that the American Podiatric Medical Association has a list of shoes and other foot care products that pass rigorous tests.
Correct.
That parents can view and make a determination about what's best for themselves and their children. They can get that from www.apma.org, I believe.
Correct.
So that's a good resource. I want to talk about other kinds of foot health problems that you see in kids, especially going up to teenagers. We both have teenagers.
Sure.
My son just had a wart, for instance, which I thought was rather odd. I've never had one, and I've never seen one.
Sure.
To see one on a kid, and as I understand, it's very common. But that's a number, though. It's one of the many problems that you see in teens, especially who are active and growing like that.
Well, one thing that you need to know about warts is that it is an infection of the skin. It's a papillomavirus that causes it, and basically it only exists in two animals, us and in pigs. And that's one of the reasons why you can use the genetics is the same. That's why you can use pig grafts when you're doing some of the grafts for burns. But that's putting it very, very bluntly. But warts are becoming more resilient. It is a viral infection. As I said, it's a papillomavirus that causes it. And why does it happen in children? Well, especially during the time of puberty. Again, in that same age group we were talking about with growth plate injuries, this is a time when the child's immune system is really developing. They tend to perspire a lot. Warts, just like fungal problems, they like warm, moist, dark environments. They invade into that area, and they can really take root and take nest in there. Warts, when you cut through them or you try to scrape them, which a lot of parents try to do to see what this is, they'll find that they bleed very easily, and that's actually pathognomonic, or how you really can actually know that that's probably a wart. If you see those little pinpoint dots that bleed when you try to scrape it. The problem is that there's a lot of over-the-counter remedies for this, and you have to realize that all of these over-the-counter remedies are basically acids or freezing techniques that are now available over the counter, and if it's not done properly, that acid can actually damage the tissue that's around the wart, and actually you can start to minimize the wart in the middle and actually start to see it spread in that compromised tissue that's been caused by the acids or the freezing. So again, if you see that this is something resilient, if you see especially that it's spreading, I do suggest that you get podiatrists to take a look at it. We have multiple methods of taking care of these warts, and quite effective ones at that.
What are the kinds of treatments that you typically use?
For warts? There, again, all treatments that are out there for warts basically destroy the tissue. It's all burning, whether you're using a liquid nitrogen type of a situation, whether you're using a laser, whether you're using different types of lasers, whether you're using a cautery unit. You're basically burning the tissue to try to eliminate as much of those viral particles as you possibly can, and then let the immune system take over and do the rest. But they do have a high tendency to come back. I have had warts that have come back after you do them, and parents have to realize that this is an infection and you're trying to bring it under control. Similar types of infections are fungal problems that I mentioned as well, and children, again, especially because fungus, just like a mushroom, loves its warm, moist, dark environment, and kids, they get into their shoes, they get into their socks, and folks, we don't see them for about 8 or 9 hours or more, and they come back and they're wearing the same socks that are now dirty and sweaty, and this is the prime environment for warts and fungus.
We also see, more and more kids are playing baseball in the summer, lots of activities, even and especially girls. And then they roll into the school year and they're on a team of some kind. So there's a lot of planned, organized activity.
Correct.
And so the risk for overuse injuries is growing among especially 8 to 12-year-olds, and then 12 to 16-year-olds especially.
And again, the push to be athletically minded and to really do all the traveling teams in baseball. Again, I wonder sometimes if we aren't pushing our children too much. But again, this one around this type of organized activity and this kind of almost necessary thing to take our kids around to all these places. But again, that does bring the problem out with overuse injuries.